Hi, I'm Antoinette and I'm doing my Foley catheter insertion validation video. I would start by walking in the room, providing privacy for my patient. I don't have a door or a curtain. I would perform hand hygiene. We don't have a sink in this room, so we'll just pretend like I did. Then I'm going to introduce myself. Hi, I'm Antoinette. I'm going to be your nurse today. Can you please state your name and date of birth? I'm going to compare it with your hospital band. Okay, perfect. Do you have any allergies to iodine or latex? No? Okay, good. As you know, we have a doctor's order to insert a Foley catheter. So we're going to go ahead and do that. I'm going to bring the bed up a little bit and lay your head back, if that's okay. I'm going to go ahead and pull the sheets down to expose you and set up a little area for my garbage. Just fixing your legs a little bit so we have enough room to work. You comfortable? Okay, good. Bring this back. Wash my hands again before I touch my sterile stuff. Here is my kit. It is a 14 French. That is what the doctor ordered. This table is below waist level, so I wouldn't use it in real life, but it's all we have to work with, so we're gonna use this one. Now I'm gonna open the package. Dispose of that. And now I can start by opening my field away from me to both sides. Staying within the 1-inch border. And lastly, this towards me. And then I can grab my sterile gloves without turning my back. Come over here so I have enough room to put them on. Just touching the inside cuff. I'm going to put my dominant hand on first, slipping my fingers inside the cuff without touching the inside of the glove, and the other hand. All done. Now I can adjust. Perfect. And now that I have gloves on, I can touch the inside of this drape here and just move that as long as it's within my 1-inch border. So I'm going to pick up my sterile drape, shiny side down. So I'm going to grab it and bring my hands, inside to drape under the patient. And then I would take my fenestrated drape from the corner and open that and place that shiny side down over his penis. And now that's all sterile, so that's good. Now I can remove my top cover, staying within my 1-inch border. I'm going to take my swab sticks, open them, and put them in the far corner of my box here. Same with the second package. Okay. I'm going to attach my syringe to the port. open my package of lubricant for the catheter tip. Now I can carefully, within the box, remove the plastic sleeve off of the catheter tip and place it into the loop. Good. And I don't need this. I'm going to put it over here. And now I'm going to take this entire thing and bring it over to the bed next to my patient. Now, I would start by cleaning the meatus. So I'm going to hold at a straight up, so we have enough room here. And now that I've touched here, my left hand is no longer sterile, it is clean. And I would clean from the tip out, going around just once with each cotton swab. And do it with my other package. So you're going to do it 6 times. Nice and clean. And now we can carefully remove the catheter tip from the lube and insert it into the urethra, advancing slowly until we get a urine return. There's urine in the bag, so we know we are in the bladder. And now I can let go and advance to the bifurcation in the tube. Now that the catheter is completely inserted, I can hold that to steady my tube. I will inflate the balloon 5 mL because that is what the label on the balloon says. And while applying pressure, I will remove the syringe and dispose of it. Now I will gently pull back until I feel resistance. Resistance has been met, and I can remove my gloves, hang up the bag on the bed, attach the tube to my patient's leg so it is secure, and then I can put another pair of gloves on and clean up all of my mess here. I will attach my label to the tube so that everyone knows when it was inserted and then when it needs to be changed. I'll cover my patient up, make sure they're comfortable, call light, ask if they need anything else. I would wash my hands, perform hand hygiene, remove my gloves, make sure I take all my garbage with me, raise the head of the bed, all that good stuff, and then now we have a doctor's order to remove the Foley catheter. So I would walk in the room, introduce myself, make sure my patient doesn't have any allergies or pain, position them correctly. It is a sterile technique, clean technique, sorry. And so all I need are gloves and somewhere to put my garbage. So I have a chalk and a syringe to remove the water from the balloon. So come in, wash my hands, put gloves on. My patient is positioned. I have a doctor's order to remove the Foley catheter, and they are aware. So now I can expose them. And I'm gonna place this in between the legs so we don't make a mess on the bed. I'll take my bag off the hook. Unstrap it. You would want to save that because you would have to empty it and measure the output afterwards. And then all you got to do is remove the cap, attach it, and pull back on the syringe. Then you would empty it, and do it again just to make sure get all of the water out, because you don't want to hurt anyone when you're pulling out a partially inflated balloon. Garbage. Now you can pull slowly. Tell my patient to breathe, bear down, make sure they're comfortable, not hurting them. And that's done. So clean up the mess, take off my gloves, wash my hands, cover up my patient. Raise the head of the bed, make sure they have a call light, and come back to check on them later.